and welcome to our Meet the Maker series. My name is Ed Steger, and I'm the president of the National Foundation of Swallowing Disorders. I'm also a long-term head and neck cancer survivor, going on about 19 years, and I was diagnosed with a severe swallowing disorder in 2007. Our goal with this series is to offer our community access to those who have created products specifically for people with swallowing disorders. The series is not meant to be promotional, but rather informational. We want to give you the opportunity to ask the creators of these products your questions, learn more about how these products help people with swallowing difficulties, and make connections so that your voices feel appreciated among our industry partners. We thank you for joining us this evening for our first webinar of the year. I hope it's not too late, but I wish you all a happy new year. I hope it's been a good 2024, and I hope that you find the series helpful. Thank you to those of you who made a donation with your registration or who have become members. It is only with the financial support of our community that we continue to further our mission. The makers in this series are volunteering their time to share this information. They have not been paid to participate in the series, nor was it required that they be a past or current financial sponsor of the foundation. If you participated in a NFOSD webinar previously, you're likely familiar with our system. You will be muted during the presentation. You can type questions in at any time into the question box. This will be recorded and available for free. There are no ASHA CEUs awarded, but you will get a certificate of participation once the webinar is finished. With that, I want to provide a reminder that tonight's broadcast is for informational and educational purposes. Both the NFOSD and tonight's speakers do not intend to provide any diagnostic or treatment advice or recommendations. If you need assistance identifying a swallowing specialist in the US or worldwide, please reach out to us via email. And now it's my pleasure to introduce the manager and director of Wibbi Speech, Nicola Jobin and Anne-Marie Bachon. Nicola has been with Wibbi for 7 years, helping to develop a platform to improve patient outcomes and adhere to treatment programs prescribed by healthcare providers. Anne-Marie is a speech pathologist with over 11 years of experience in voice and acquired language disorders. She joined Wibbi in 2022 and since then has played a pivotal role as a product director, uh, enhancing patient engagement through innovative web applications. And with that, I will turn this over to Nicola and Anne-Marie, who have again kindly volunteered their time this evening to present to our community. So with that, please take it away.
Yes, thanks, Ed. Thanks for the presentation. Thanks for the introduction. Do I share my screen now? Do we see my screen, Anne-Marie?
Yes, I see your screen, but I also see all your tabs, so you have to put it in a full screen.
Okay, perfect. Good. Sorry for that little technical difficulty. Yeah. So hi everyone. Really, thanks to have joined this webinar. Thanks, Ed, again for the introduction. Thanks to the National Foundation of Swallowing Disorder for giving us a chance to talk about what we do, about who we are. You might have noticed, or you will at least from now notice, I guess, that I have a strong accent. That's because I'm French Canadian. English is not my first language, so I promise I will do my best. To start, I think it makes sense to give a little context and talk about who we are and where we come from. So in 1993, Wibbi began his journey as Physiotech. It's a platform for home exercise video and program mostly used by physiotherapists. And over time, we realized that the demand for our solution extended far beyond physiotherapy. We serve occupational therapists, we serve chiropractors, even veterinarians, so a lot of professionals. So we transformed into Wibbi, and we developed our offer to meet the needs of a variety of professionals. One thing that is really, really important to us, that is core to who we are, is to collaborate with the community. It's the engine of all the development, any feature, all the content. The starting point is always a request from a user. So we listen to the patient, we listen to the therapist. We're flexible, we're agile, really we care. And this is how we came to the speech therapy world also. It all started from a request from a group of speech language pathologists. They were familiar with our offer in the rehabilitation industry, and they simply asked for 30 exercise for voice disorder. And we're really serious about user requests. So we hired a speech therapist to produce the exercise. Actually, we hired one of the speech therapists that did the request to produce the exercise, and she's here with us tonight. It's Anne-Marie here, and so we produced those exercises, we published them, and then we got a lot of traction on that, and we realized, that there was a need in the community. So since then, really, we're on a mission. We're on a mission to serve the community. We develop content, exercises, strategy that are just easy to understand for patient, of course, but we also develop technology that promotes patient adherence support speech and language pathologists and the daily implementation and popularization of treatment plan. And honestly, it's fun. Really, I'm having a lot of fun to do that. And it's a real pleasure to meet dedicated professional every day and to work with Anne-Marie, my colleague, and my colleague that will now take over the presentation and that will explain us a few of the principles that are fundamental to us and that drive the development of the content in the future. So Anne-Marie, I think you can go ahead.
Thanks, Nico. Thanks. Yeah, I'm French Canadian also, so I would do my best as Nico. Yeah, so why Wibbi is more than just cool, because Nico said that it's a technology, it's a tool for speech language pathologists. But one of the objectives we had when we started this project was really to create a complete tool that meets the principle of patient engagement. But first, we had to know what is patient engagement and why it's so important for Wibbi. And principle of patient engagement, it simply promote respectful, compassionate. It's also culturally appropriate and using a competent care. I'm pretty sure all of you guys, as a healthcare provider, already using all of those skills. But in patient engagement, all of those are responsive to the needs, to the values, beliefs, and preference of patients and their family members. And it's a very important thing in patient engagement, because when the therapist came to be responsive to all of that, the therapist makes sure that the relation with the patient is level up to a partnership. So it's not anymore having the therapist on top and the patient under a peon and just driving, and just the therapist driving the care. No, it's more that both of the partners feed the care with their knowledge. So they are on the same line. Both of them have knowledge. Patient knowledge is very important here, because the patient is who is living with the condition. What is feeling about this condition? What is feeling about impact in daily life with living with this kind of disorder? And it's very important to us to listen to this, to listen to the patient knowledge, and to bring them with our knowledge as speech pathologists or as healthcare provider at the same line than us. And both of the partner, when they use a partnership relationship, will be on the same line, and the progress will progress at the same rate, like a gear. Like you see when a clock runs with a cogs, it's the same thing when you use a partnership. And why is so important to use patient-centered care in our healthcare services now, and also why is driving us in Wibbi? Simply because patient engagement is evidence-based, and the consequence are improving treatment outcomes, patient satisfaction, and consequently health outcome. It's wonderful. If you use a partnership, you will improve care. And as Nico said, that's our mission. So it was natural for us to build Wibbi around those principles. And yep. Here are the patient engagement principles. You have capacity, you have responsibilities, you have goals, you have partners, and you have progress. And just on the side, you have those we have worked to integrate to meet the need to building patient competency. It's a center of Wibbi development to build the competency of your patient. We want them engaged early in the process by provide them relevant information, context, prevention, and also provide exercise, strategy, anything that you want, anything that you know that it's useful for your patient will also allow the therapist at the beginning of the treatment to build his value and show that you, as a speech therapist, you are the perfect specialist to help with this condition. It's simply to say, hey, I'm here. I'm the best person to help you because I know this condition. I will listen to you and I will treat you as well as I can. And by engaging patients early in the process, they will build up the capacity to stay engaged in the treatment plan. And as I said, it's also a key in patient engagement that both of therapist and patient are equal. We have to consider patient as equal to us as therapists. We wanted to create a support environment, a supportive environment that allows dynamic feedback. What it's mean? It's mean that you share responsibilities. We provide content, we provide exercise. Our patient consume those, make the exercise. But also when they come back to our office, it's important to validate what they understood at home or what they understood about all the content I gave to us during the last lesson. It's very important to share responsibility. So you have to validate where they are, to stay on the same line than your patient. And for doing that, you engage patient in progress reports. And for Wibbi, it's important to keep patient on top of their abilities. It's important for us to build their competency, to build the patient competency. It means that we want them to own their rehabilitation by being on your side, by being helping by you. So when you engage them in progress report, you say, hey, you're the boss and I will listen to you and I will help you to go far. And when they progress report, they build self-consciousness about what they're doing and why they're doing it. So they recoveries, monitor, supervise, so you can modify and suggest anything that is needed to keep the patient engaged in appointments with Wibbi. So as I said, it's the key for partnership, the key for patient engagement is really partnership. So for Wibbi, we improve healthcare. I just explained to you how it's important for us to consider the patient in in main object of the care. But if we stick to patient engagement principle, a clinician is at the same line. So Wibbi will add value, will create value also for you as a clinician. And we want the speech language pathologists be more effective, save time. I'm pretty sure you get exciting about this, okay? Yeah, I will save time. Yes, we provide all-in-one platform with different tools. We allowing therapists to optimize their time. Like, we want you to eliminate repetitive tasks. We want you to do something faster than you are doing now by using all of our inclusive platform. We want you to be motivated, but we want patient motivated. And if you share easy and convenient content in order to engage your patient, they will see the outcomes, you will see the outcomes, and this will drive excellence. As I said, we want an excellent care for patient, but also we want an excellent care for you. And an excellent care goes with home practice specificity. And it's a nice key, a real key for a clinician, that if you if you have the continuity between the quality of the support you're offered in your office as the same in a patient's home, that's wonderful. And we strongly believe that improving home care, home practicing, will optimize outcomes. And when your patients are very engaged, they build, as I said, they build competency. So they want to show you, are they good? So you have to be more responsive to their progress, to their needs. So we optimize the communication and engage dynamic change between the appointment. So if your patient reports some kind of, hey, I'm doing this very well, I'm not having pain anymore, or I'm not having struggle with doing my exercise anymore, I can do 20 reps in a row, that's good for me. That's good for you, because he doesn't have to time to come back to my office. I will give him another exercise, a quick call, and it will keep going. And not far beyond, but just beyond the patient, okay? There's something very part of our clinical daily activity is our practice, is what we think. And by provide evidence-based content, and by provide a variety of content in our platform, we want to standardize the practice, and we want to share knowledge with all the speech language pathologists community. It's important for us to enable speech therapists to educate patients or professionals and spread their knowledge, but also share their expertise, because I know that you're very good and you're essential for patients and for the population. And I know that you choose the best profession in the world. So it was fundamental for us to provide exercise and content on demand. because our user, you as a speech therapist, know better than us what works for your patient, and we listen to you, to your needs, also to your values, because we know that speech therapists not having necessarily the same values than physical therapists, or we have something very unique as a speech therapist. So it's we listen to you, and we know that something that will help you as a speech therapist will probably help a lot of more. And I'm pretty sure that building a library of content generates you an open mindset. What it means? It means that we all those speech therapists to think other way, other exercise, a new approach, something that it's not necessarily what you do, but you're stuck in something. You're asking yourself if you're doing something wrong or if you can do something different. But when you go on Wibbi, you see all those exercises and you questioning yourself. You said, hey, can I do this? Oh, should I do this? Should I try this? And it will help you go deeper in your clinical reflection. So that's pretty cool because that's adding you something to open clinical thinking. And I'm just talking about all those principles, but I'm pretty sure you want to see what is Wibbi. So let's see how this principle take shape in Wibbi. And let's dive into Wibbi with Nico. Nico is more familiar than me from all the specificity of the platform. So I will let him go with you now.
Thanks, Anne-Marie. Thanks to have talked about all those principles that were fundamental in this project. Good. So let's dive into the product, into Wibbi, and into what it is. I would like to start by showing the platform from the patient perspective. And please reassure me, you still see my screen? You still see the patient portal right now? Yeah, okay. Good. So what you see right now is Wibbi from the patient perspective. It is a portal where you have communication. You can communicate with your therapist if you want. There's outcome measure forms. You can share documents right here, and probably the core of the portal might be the program right here that you have. So therapists will assign like exercises or objective to their patient, and they will look a little bit like this. You will have instructions right here for every exercise, video for every exercise also to see how the exercises are performed. What else do you have? You have a built-in timer at the top, so you can track how much time it took to do the exercise. And then patient can track completion, difficulty, pain, number of sets, number of repetition, and so on. So whenever they do the exercise, they're self-conscious of their progress, of their compliance, and they share this data, of course, with the therapist. And it will be shown on a board just like that, so they can see their progress for the week, for example, see how they do, how they improved, and so on. This portal is available in different ways. It's important that it's accessible for patients, so you can see it on the computer, like you're seeing it right now. You can download the app. You can have it on your telephone, on your browser. It will look a little bit like this. And you can also print the home exercise program. So printouts will look like that. I guess this is one of the options, of course. You can print them for your patient and print tracking sheet also so they can fill it in. So honestly, most of the time, therapists, they will combine different methods together. They might print it for the patient. They might send it by text message to the family. The idea is really that to give you different ways to share the content. Good. So that's from the patient perspective. Here, now from the therapist perspective, the platform will look a little bit more like this. First step is probably to like search for content, select exercises. Of course, we mentioned that a few times. Like exercise on demand is really core to what we do. It's like how all the content is created mostly on our side. So you have the possibility to search exercises that are already in the library that we produce, that are some of your requests, some of the requests of other users. You also have the possibility to create your own exercise too. So you can create content in your own account that will be available only to you, and download videos, put YouTube link, any kind of content there, really. Now let's have a look. Let's build a program like for a patient, and let's do it from the exercise that are already there. So let's say I want to stay on topic and build a plan for swallowing, for example. I'm simply going to go like that, search like I would do on Google, and then I'll have results. And you'll notice that there's always a classification that happens. So you see like a few strategies, food modification, and so on, like that. So as a therapist, you'll simply pick a few exercises by clicking on the image. And whenever your selection is completed, you will click on the green button, View Program here. And then you'll have your exercises. On this page, it was really important for us that there's two objectives basically that we have. First, we want speech language pathologists to be efficient, to like save time, basically, to build a program as fast as possible. But we also wanted them to be able to adapt the exercise and adapt the content and be as specific as they can on their side. So basically, you land here. You can move the exercise around to change the order. You can apply parameters to many exercises at the same time. So let's say those 3 exercises, they have 10 reps. I don't know, they're done 3 times daily. Simply gonna go like that, assign them to the selected exercise, and let's go for 20 repetition for the unselected this time. So you can assign parameters to many exercises at the same time. You can adapt them one by one from the list perspective here. So I don't know if you want to hold the Masako 5 seconds, you can just adapt it like that. And you can also do it from the expanded view. You can modify the parameters, you can change everything, the instructions, the title, the images, the video. So you're fully in control as a therapist, you're fully in control, and you make sure to share the content in a way that will be understood by your patient. So you can simplify the instructions simply if you need to. So you build a plan, you adapt it, you make sure it will be understood, and then you'll simply save it and send it to the client. So I'll call this one test for today. Right there, I'll assign it to my client. We integrate to a lot of EMRs, to a lot of clinical management system. The list is on our website. So you save the program, you can then send it by email, you can send it by text message, pretty convenient those days. You can print the home exercise program as mentioned. What else can you do? You can share patient education document, outcome measure forms. You can set up automated message also around this home exercise program. If you're I don't know if your patient are at home, it can be kind of interesting. You can set up reminders, of course, but you can also be positive and just send message if your patient are compliant also. That's kind of interesting. And probably the most important thing there is that this whole treatment plan, that program, can be set as a template, so you don't keep building the same plan over and over again. So you can create as many templates as you want, and you can even share them with your colleagues that are working in the same facility or in the same setup. And there. And that's it, really. And then when you're finished, you click exit like that. And template is probably like the key to efficiency in the software. Like 95% of our user, they mostly work from template. So most of the time, you'll access Wibbi and simply pull one of the template that you created, like the test I did today. And then therapists will adapt a little bit the template, modify a few things, maybe add exercise to it, maybe they'll simplify the instruction if they need, and then they'll simply save it and send it to another client. So that is pretty convenient too, and of course will save a lot of time. So those are the main feature on the platform. Of course, I didn't want it to over-explain everything there. It's really important for us, like the communication with the user. We train everyone that is using the platform individually. So if you start using Wibbi, we'll meet, we'll talk together, and I'll take the time to show you how it works. Now, I think it could make sense if we switch to the question and answer simply, and we take this time to interact together.
Excellent. Thank you both so much for presenting on this. I think I speak for many speech pathologists that are on the call that this is a new technology that we are not familiar with. So we're glad that you've shared this with us. I have a few questions here. The first one is about compatibility. So if somebody's using Wibbi for patient home exercises, is it compatible on a phone or a PC or a Mac?
Yeah, really on any device, any browser, except Internet Explorer. I say that sometimes because there's still people using Internet Explorer, but everything is supported on any browser, any device, really.
And I will add to this response that it's also very convenient to people to use it at home. So we start some study with people with dementia using it. So it's very convenient for people with like language disorder or dementia or cognitive disorder to use the platform at home. Sometimes you just have to help them first register in the platform, like create them the password, but the other time they won't have to do it again. So it's very easy to access at home.
Excellent. I have a question here from a fellow French Canadian on the call. They were wondering how many languages that this is available in.
At the moment, it's French and English, but we know we will translate in Spanish, like probably in 2024, at the end of 2024.
Question from a pediatric clinician. Are there exercises geared specifically towards pediatrics versus adults?
Yes, there is exercise geared for pediatrics. We have some, Anne-Marie, for swallowing, do we? For pediatric swallowing, or we have requests for that?
We don't have yet a request for pediatric swallowing. We mostly have for OMD request, but that, as we said, we produce content on demand. So if you need something about pediatric swallowing, we can do. Or if you want to, I don't know what are you using with pediatric rehabilitation in swallowing disorder, but if you just want the same kind of exercise but with a pediatric models, it's okay for us to do it, because it's very important that your patient can really represent them in their screen. So as I said, like specificity is very important for us. So if it's your needs, we'll listen to your needs.
Yeah, exactly. Like exercise on demand, again, is so core to who we are, to what we do, to the way we work as a company, that that we guarantee that you'll have the content you need. And it doesn't matter if it's really, really specific and you're the only one doing that kind of exercises, like I don't know, in the US, for example, if something like that is even possible. But we'll produce it and we'll make sure that you have what you need to work.
What's the process and timeline, and how do people ask you for that specific content to be developed?
Yeah, it's basic. You want to answer, Anne-Marie?
But yes, it's basically you just request your exercise by mail with the client service, will be with Nico, and after we have a process under to produce the exercise with me. And if I'm not familiar with those exercises, or if I've had question, or if you want to make sure that I'm doing your needs or your exercise you need, we can talk together. You can send me some examples, like we can do some meeting together to just make sure that I'm produce the right content for you. And now we having in mind that we need to be like 4 to 6 weeks to produce content. But be honest with you, now I'm not in 4 to 6 weeks because we building the product, but I'm about 2 months to produce your needs, your exercise.
Excellent, thank you. Are there any institutions right now that are using this as part of research and gathering research on patient adherence to exercises?
Yeah, right now in speech therapy, yes, there is, but it's a preliminary. Is that the good word in English? We have this politic to simply collaborate with research project, and we done that a lot in the other product. Like we've been doing that since 25 years. So if you have any project, if you have research project on your side, it's always free to collaborate, and we will simply support you. And it's always fun for Anne-Marie and for us to participate to those projects.
And I know a big question that comes up here in the States and probably internationally as well is HIPAA compliance, so protecting patient information. Is this program something that is compliant with that and protective of that information?
Yeah, absolutely. I'm not a security expert, but the basis of this product is the same than any other product that we have, like the machine behind it, if you want, the setup, the technical setup. So yeah, we're HIPAA compliant, GDPR compliant. I think it's PIPEDA in Canada. So all the regulation are sorry, I'm searching a little bit for my word, but we're compliant to all the regulation in the countries. And we got servers in the US and Canada and Europe. So, but we can provide information, all the technical information on demand, also on this setup and how we comply to HIPAA, for example.
And the product is already not the speech product, but the physical product or OT product is already used in hospital care and long-term care worldwide. So that it's okay. It's like the security behind that. It's okay to use in a hospital or in a hard care service.
Excellent. And here's a question that several people have, wondering about the costs and how people acquire Wibbi for their hospital or for their outpatient care.
Yeah, it's a user-based price. If you want to buy Wibbi for yourself today, it's typically a subscription of $49 per month to have access to the software. Of course, the more user you have, the lower the price per user is. So it really depends on your setup after that. So it can range, I guess, somewhere between 49 per user until 15 or 10 per user, if you have a really big setup, for example.
Excellent. And by user, is that the clinician? So let's say you're working at a hospital and you have 5 SLPs on your team, that would be 5 users and not by the patient assigned. Okay.
No, no cost for patient, no cost for patient.
Excellent. If there are some people with dysphagia on the call tonight, if they were interested in looking at this software on their own, is that something they can do, or is that something they really need to have their speech pathologist on board with?
They need to have their speech pathologist on board with, because without the context, without the knowledge, there's nothing to do really with the exercise. So it's really a tool built for speech therapists, for professionals to build treatment plans. So they can talk about the product to their speech language pathologist, but it might not be useful for them directly to use the software.
Excellent. Are you aware of any similar products that are already available that do something similar to this?
There is a lot of product. It's hard, you know, but I feel that with our vision and the way we want to work, it seems to be unique a little bit at the moment.
Mm-hmm.
Like this focus we have on speech therapy, and we have this goal also to just integrate the whole treatment plan, and what you've seen today is just our first step, into like serving the speech therapy community. So at the moment, a holistic product like we have or are envisioning, because we're still building a lot of stuff, a lot of content on our side. I don't feel there is necessarily. There might be that I'm not aware of, but yeah, I feel that we have something a perspective that might be a little bit unique at the moment.
Yeah, I'm agreeing with Nico that we're pretty unique. Just because it's all in one, or like all-inclusive platform. That's why we are so unique, because you, a speech pathologist, have access to other technology like application for exercise or language materials or everything, kind of things like that. But like all in one, that's why I would say that we are unique.
I have a clarification question from somebody. If a patient's using this at home, is there an app that they download for their phone, or are they using this from an internet browser?
As they want. If they want to use it on phone, they can use it on phone, or if they want to use it on computer, they can use it on computer.
Excellent.
And even on their,
sorry, could they use it on both if they wanted? Let's say they're out in the community and they want to check it on their phone, and then at home they check on the computer, and it's the same, it updates.
Yep.
Excellent, thank you. I have another question here about clarification, that this is a tool for treatment plans and demonstration, and for home carryover practice, correct? How you would kind of summarize what this tool offers?
Yeah, it's to a treatment plan. I think summarize it kind of well, and we say I realize like today we really focus on like home specificity or external specificity, but most of our users actually like they work with hospitalized patients. Like that's the majority of our user. Is what they do. So they start the treatment plan when the patient is at the hospital, internal, and they'll print, they'll send by email, and then they'll pursue the treatment plan like in the outpatient setup or something like that, at home. But it kind of, the big volume of the program that are made are probably for patients that are like in the hospital, like in the platform. So it works well there too.
Excellent, thank you. You spoke a little bit about, Anne-Marie, evidence-based practice. Question here for you, is there information about evidence-based practice around specific treatment options if a therapist wanted to look that up? So let's say they knew the person's swallowing deficits. If they knew what those deficits were, would they be able to figure out what treatment, specific exercises would be recommended for that patient using Wibbi?
Actually, it's pretty cool because we just talked about this afternoon, Nico and I. Actually, we don't have the context for using the exercise. We make sure that there is evidence-based behind or the behind. Is that right? Yeah, behind those exercise was asking to us was asked to us, but we don't have the possibility to explain the context or explain, oh, this new exercise is for swallowing disorder or voice disorder, but we have in mind to do it, or a way to do it. We have a newsletter. Maybe it's a good way to like it's a good way to say that we have a new exercise, or hey, look, we have create templates with this researcher here in Canada or here in US, and he works with swallowing disorders. So let's check her templates. Or actually, it's now the way we can do it, but we know that we have to be better on that.
Yeah, and to be fully transparent, like we also have nice discussion around that, because there's always this balance that we want between you know, having everything being evidence-based and integrating like the research and the knowledge and the system, but also giving like our user, our professionals, and sometimes they do some exercises and they just work, and it's the way it's done, and like for us it's kind of a balance that we need to be able to find, yeah, exactly, between the requests but also like what you should be doing there. So we just need to find the right way to do it, like for our users.
Thank you for that. Yeah, I think it's so important that the clinicians are critically thinking about what exercises are important and relevant for their specific patient. And one thing that we emphasize at the foundation quite a bit is that not all exercises are suitable for every patient. It's really patient specific. And
of course.
Yeah, most aren't dangerous to perform, but if they're not helpful, it's not worth your time to perform exercises that are not helping your swallowing disorder. And so that's really important to say, to know which exercises should be prescribed and not have patients doing all of them.
Yeah, and that's why we also like not sharing our exercise with other healthcare providers. So if you have access to speech therapy exercise, you don't the OT or PT don't have access to your to our content, because we are those who are able to prescribe those exercises.
Excellent, that makes sense. Another question here for you. We have some students on the call tonight, and our foundation tailors a lot of our content to students because we recognize those are that's the future of who will be treating people with swallowing disorders. Do you offer anything for students to learn about your program or to learn more about swallowing exercises?
Yeah, absolutely. A student can use the program for free as a library in their for the time that they're at school or they're on placement. So it's basically a free access. You can contact us and we'll get you started.
Thank you.
I will encourage students to go use it, because as a speech therapist who supervise a student, it's a very good way to learn them some approach. Like as a head said, I'm specialist in voice disorders, so sometimes I use Wibbi for my student to say, hey, let's go just check what is a vocal function exercise, for example, or other exercise, and just go check, do it on yourself, check, do it, and then we talk about this after. So it's really cool for a student. It's a really nice way to learn about what we are doing in speech therapy.
Excellent. Nice. I think there's one more clarification question here. Is it correct to say that Wibbi, it's not a treatment itself, but it's an online way for a clinician to make their own plans, treatment plans for the patient available, correct?
Yeah.
Absolutely.
Excellent.
Absolutely. It's all personalized. You are the boss of the platform as a speech therapist.
Perfect. And if a clinician just wanted to test it out, it sounds like you'd be willing to make that available to them to make sure it's something that would fit for their practice before they purchase that. Is that correct?
Yes, you can do a free trial. You can go on our website, request a trial, and of course we'll let you play. We'll let you use it with real patient also. So you really measure like the value of the tool.
Sounds good. I want to be mindful of the time and be respectful of your time tonight. So I'll wrap things up there, but if anybody has any question that we missed, please feel free to email that to the foundation and we can forward that to both of you. Nicola and Anne-Marie, thank you so much for volunteering your time and for sharing this product with us. To the audience, thank you for joining us. This was our first webinar of the year. We will have another one in March. I will send out some more information on that. I will also be sending out just a very brief survey about tonight's webinar, and we appreciate any feedback that you can provide us. That helps us improve our webinar series. And with that, we will sign off. Again, thank you both for presenting tonight, and to our audience, thank you for joining us, and we hope to see you again in March. Take care, everybody. Good night.
Thanks
Thanks
everyone.
a lot.
Bye.